Hello, everyone, and welcome to this audio podcast. This is an audio podcast in surrounding a research poster presentation put forward for the International Paediatric Transplantation and the International Paediatric Transplantation Association, IPTA 2023, wherein this research poster presentation is an overview using the internet and online methods or online methodologies or data collection and a retrospective review on application. This was a collaborative effort between the renal patient support group, the RPSG, the kidney disease and renal support group, renal support or KNARS for kids. For kids and an academic institution as well, and this overview uh, um, in this overview, I'll provide a basis in around by highlighting specific aspects around this sort of this the works and the works that this works that took place. So, in around the aims, the aim here was to conduct a retrospective review of one online methods or methodologies for qualitative and quantitative data collection and research. And number two, explore consent and ethical issues. And number three, the implications for prospective or future research practices. So in and around the background of this, the research using the internet provides sort of unparalleled opportunities for subject access and is not limited by constraints of time and geography. Qualitative research or work aims to convert visual or narrative data into non-numerical or quantitative outcomes, wherein, for example, qualitative research helps to identify answers to the what, the why, the how, and not so much how many or the frequency, and is characterized by its own distinctive vocabulary which reaches across healthcare specialties and disciplines. Now, the qualitative data collection sort of modality or model aims to complement a sort of numerical or quantitative research investigations by producing records of semi-structured dialogue or focus group conversations, observational research, or film capture, documentary inquiry, or survey. And an example of relevant to allied health professional sort of research or allied health professional based sort of research or nursing research or in context or in context of medical or clinical research at the same time is was sort of where there was an investigation where where where, for example, interview based research looked looked to gain the experience of NHS care and treatment in lymphoma patients, and this was works by Zeeblund in 2011. Data collection has become increasingly important in and across healthcare specialties, wherein traditionally, for example, data collection was sort of a primitive basis linked to, for example, nursing research. However, the emphasis on evidence-based medicine or EBM, together with the recognition of the importance of quality of life, has prompted healthcare professionals of all disciplines to acknowledge sort of the value of qualitative methodologies, which can provide a new dimension to data relating to experiences, attitudes, and belief belief in order to inform and develop better healthcare strategies. The design and methodology in and around this works was that two searches were carried out or conducted, wherein number one was using PubMed Central, and Medline databases, and two was using EBSCO host engine, searching where EBSCO host engine is linked to search engines, additional search engines such as Signal, um, uh, 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 where EBSCO host engine has an interlink with searches for and through Signal, plus psychology and behavioral sciences collection, health source, nursing and academic edition, international bibliography of the social sciences, SOC index, full and site info between when the search strategy was between 1995 and 2013, in both search strategies. The main terminology is used to search through databases, included qualitative research, quantitative research, online data collection, World Wide Web, the internet, and a critical appraisal skills program, or CASP tool, was used to help analyze different papers accordingly. Now, after abstract, in and around the synthesis of results, after abstract quality appraisal, 54 papers were identified as being relevant to this review from search 1, and 19 papers from search 2. And from the abstracts, 5 research themes were identified. Findings indicate that internet research expedites outcomes, expedites outcomes when compared to conventional methodologies, and at the same time is a practical alternative for interviewing, validating measures, and studying vulnerable patients. Vulnerable populations. However, only 10 of the papers reviewed involved the implementation of online methods to collect qualitative as opposed to quantitative data. The variety of web-based platforms allows greater scope for collection of qualitative data in respective variety of research disciplines. And so, for example, at the same time, the privacy and the internet, that internet questionnaires or surveys, in the privacies that the privacy of that internet questionnaires or surveys improves data value by reducing response bias, and confidentiality is believed to be to assure is believed to sort of empower assurance in participants, enabling them to reply to sensitive and delicate questions more openly, and reducing reply partiality and investigator inclined preference, thus improving the truthfulness and the factual content of communication and exchanges. And this applies to quantitative questions, quantitative research, or questions, providing methods or methodologies for metric data analysis, which have proven which also prove to be important in line to quality and provenance. And so there's works by Griggs, in 2011, who looks at to provide an evaluation of the internet as a medium for ethnographic data. Now, in line to the themes that were identified, as mentioned, there were five main themes that were identified in this works. Theme one was aligned to using different media to collect data. So, online research methodologies allow scope for investigators to develop or create web pages to collect data from specific and diverse populations, um, and um, and to also readily save data in text format for importing into secondary data analysis programs. Um, and it works by Kanzaki and team in 2004 provide a sort of a good example of a study or investigation using web-based data collection to gather mixed methodologies, thus qualitative and quantitative information relating to daily coping experiences of Japanese participants or patients with rheumatoid arthritis. And the study used an online survey delivered by email, implemented through email, and the use of e-diaries, which were submitted by respondents through a personal blog, giving access to both participant and patient and investigators for interaction and analyses. The approach was recommended for future research with participants with long-term conditions, for example, chronic kidney disease or CKD. And theme two around this was aligned to maximizing responses. So online surveys and questionnaires consist of structured and closed questions and can be posted onto news groups, email lists, emailed directly to participants, or placed on a website. And so, for example, using an email link or providing an uncomplicated universal resource locator or URL, permitting better survey distribution to participants or larger audience in context of the research. And so, when compared to postal questionnaires, internet email surveys give uh, yeah, so when compared to postal questionnaires, internet or email surveys give increased response rates when reducing the risk of multiple responses from individuals, greater speed, and the advantage of asynchronous communication, and the absence of intermediaries. And there is sort of a growing or increasing body of literature relating to online data collection, and guidance is now readily available. And there's works by, again, works that have been highlighted by Armstrong and Powell in 2009, Duncan and team in 2003, and Kanzaki and team in 2004. In around theme three, and using the internet to collect data, and also in around the reliability and the validity as well. So research populations that are difficult to reach can be challenging, and it is important that whatever the data collection method or modality, the design and purpose of the investigation is reliable and effective for the target group. And so several authors focus on reliability and validity when using online facilities to retrieve information, and the advertising of research within internet platform can encourage volunteering by genuinely interested participants, thereby enhancing the value of research outcomes and broaden the range of participant backgrounds, as seen with sufferers of chronic illness, for example. And there's works by Cantrell and Lupinacci in 2007 that look at sort of looking at chronic illness populations and research and data collection as well. Now, the validation of online data collection research should involve a comparison, should technically involve a comparison of internet and traditional information sources to identify participant bias. And in around theme four, in around ethics and confidentiality, an investigation into sort of lifestyle in a small group of colon cancer participants and patients assessed the feasibility and comparability between face-to-face versus online communication. And throughout the investigation, a project coordinator could be contacted by email and telephone to answer additional questions about protocol and confidentiality. Findings indicated that internet mediated or IM chat focus groups for ill and disabled participants can be more acceptable can be more of an acceptable forum for disclosing sensitive information that face-to-face focus groups than face-to-face focus groups. And in considering confidentiality, it is important to bear in mind that focus groups using traditional modalities or methods, although participant privacy can be maintained, research may not supply sufficient detail where delicate or individual themes, uh, although where where in considering confidentiality, it is important to bear in mind that focus groups using traditional methods or modalities, although participant privacy can be maintained, research may not supply sufficient detail where delicate or information or individual themes or manners relating to divergence are required. And so, using either a traditional or online approaches, the sort of group leader or moderator may face may have or face the same or similar challenges, encouraging vocalization of all or different viewpoints. And so in around theme five, advantages, disadvantages, and limitations. So internet access is becoming more accessible to the general population at a gradually reducing cost, and the global expansion of broadband networks is rapid. And for both reasons, access for participants is becoming less of an issue for online researchers. And there's works by Atkinson and team in 2007. The most critical limitation to the success of the internet of internet research is the satisfactory design of and preparation for research projects which make communication of actions and choices to participants clear, consistent, and transparent. So several authors report on advantages, disadvantages, and limitations of conducting research. So, for example, Bergman and team in 2008, Fox and team in 2007, and Geese and team in 2007, and also Sutter and Klein in 2007. In around this works for in this sort of research poster, there is an overview in a sort of a table format, looking at and exploring the advantages of traditional face-to-face focus groups versus online focus group methodologies. The full research poster is accessible through ResearchGate. So listeners can checking out this sort of overview on this research poster can access the full research poster through the RPSG ResearchGate page. And so uh, uh, and so in and around the conclusions are here. This review identified a total of 73 papers using two searches, but only 10 papers reviewed involved in the implementation of online methods or methodologies to collect qualitative data. And findings highlight that the internet offers novel opportunities for researchers across specialties. Collecting quantitative and qualitative research data has entered a new era, and freely available software and a range of information technology or IT applications permit new opportunities and greater flexibility in the development of research investigations. However, data comparison continues to require a blend of both traditional face-to-face and online methodologies or modalities. And online data collection for health research or healthcare research includes advantages of increased participation of subjects in minority or hard to reach groups, investigating sensitive issues in around aims and objectives of particular research, and also and also aligned to particular research questions, for example. And so um, and so gathering data from populations otherwise who would otherwise be viewed as sort of viewed as dispersed. So, for example, people with low incidence conditions and or particular disabilities. And so, it is vital that researchers using online data collection adhere to strict ethical principles and develop principles adhere to strict ethical principles and develop sort of novel or new guidelines based on experience. There is a list of resources and uh, and one of the main ones was works by Cantrell and Lupinacci in 2007, where they published works on methodological issues in online data collection. It was published in the Journal of Advanced Nursing, and so the full research poster presentation is accessible and downloadable through the RPSG ResearchGate page, and so listeners are welcome to look in on that for the full overview in through ResearchGate. So I want to say thank you for tuning in on this on this audio on this audio with an overview on using the internet and online methods or methodologies for data collection, and a sort of a retrospective review on applications. This was an overview, a research poster, sort of overview of in and around the in and around works prepared for the International Paediatric Transplantation the International Paediatric Transplant Association. So thank you for tuning in.